Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
One of the things I am doing, I participate with American Headache Society, who provide education directly from headache specialists to primary care, OBGYN, and truthfully, we can extend our information to any specialty who is interested.
Hello and welcome to Talking Head Pain, the podcast that confronts head pain head on. Hi, I'm Joe Koh, Director of Education Digital Strategy at the Global Healthy Living Foundation and a migraine patient for over 20 years. I'm here today with an esteemed neurologist, Dr. Nina Riggins, who is a board-certified neurologist who specializes in headache medicine and traumatic brain injury. She also is a fellow at the American Headache Society and the American Academy of Neurology, and she is no stranger to advocacy, having participated in Neurology on the Hill, an advocacy event in DC, as well as Headache on the Hill, which also is in DC. Dr. Riggins, it's so nice to have you today. How are you doing?
Thank you so much for having me here. Hi.
Can you tell our audience about what you do as a neurologist and what is exciting you in this field right now?
Thank you so much. That's a great question. So I am headache specialist and I'm a neurologist. And right now is super exciting time to be in the headache field of medicine. We have so much advances in new treatments for our patients. And I feel so happy that it also draws all these amazing new brain powers to our profession. I see unbelievable interest from students, residents, fellows, and education is one of my passions. And other one is advocacy. How do we get all these new amazing treatments accessible to our patients?
In terms of students, what draws them to headache medicine?
I think they really can see that we can help now. So it's amazing when students come in with us for follow appointments and they see improvement from before in disabling headache disease. It's beautiful to experience together. They feel part of the team. And I always say students and any other learners always welcome to join us. And one of the things I am doing, I participate with American Headache Society, First Contact. This is a program who provides education directly from headache specialists to primary care, OBGYN, and truthfully, we can extend our information to any specialty who is interested. Like one of the most recent projects, we're working on vestibular migraine with ENT group. So this collaboration is always super exciting for me.
That makes so much sense, and it's so important because those are the folks that a lot of migraine patients are going to see. I was talking with some of your colleagues at Headache on the Hill recently about how the majority of us as migraine patients aren't going to see them as headache specialists. I have a general neurologist who does a great job managing me, and that's reality that a lot of people that live with migraine are either not needing to see a headache specialist because of the severity of their disease or because of where we live don't have access to that. So that program that you just discussed is so important because our nurses, our primary care physicians, our pharmacists, all of the people that we're going to engage with need to know what a migraine is and vestibular migraine with ENTs so that we can diagnose them earlier so people aren't living with all of these questions.
Yes, that's so true. And many times during my day in the clinic, when I see new patients, new to me, but who had, for example, chronic migraine for years, it will almost break my heart when I hear an adult person saying, in my childhood, I thought everyone has pain every day. And it was amazing to me to see that Headache on the Hill this year did address pediatrics, so kids' issues with migraine. And actually one of the issues was proposing letter to Department of Education to support our kids when they need extra resources in school to be successful in their learning. Because migraine is not just a headache, it's whole disorder of brain networks, and it could be cognitive, it could be symptoms like nausea or dizziness, and autonomic neurosystem can get involved. And we do need to clarify that those kids need support and they will succeed with our help.
That's so important.
Yeah. I see doubts, and actually always great. Since my fellowship at UCSF, our director now of pediatric neurology, Dr. Gelfand, when I came to Miles for Migraine Teen Camp, she was so welcoming, and she said those kids will graduate into adult clinics, and they will be people who I will see. And that's how I look at that. And I actually just recently submitted my project to one of AAN leadership programs, and fingers crossed about transition of kids to adults in headache medicine. So I know a lot of work already been done by multiple bright minds, but for area here in San Diego, I have specific ideas how to streamline that.
That's amazing. And I was one of those people that thought a headache was normal, that everyone had it. And they weren't bad. They weren't like debilitating headaches most days. But I just was like, you don't get a headache when you realize that as an adult, that people live without ever having a headache. Really surprised me. And I think the work that you're doing is so important to raise that awareness on all levels. What do you think some of the big challenges are that your patients face in terms of advocacy and access?
Yeah, that brings me to our next event, which I will be flying at the end of this week. It happens in DC, American Academy of Neurology, Neurology on the Hill. And I'm extremely honored to be captain of our California team. We have an amazing team, and we have very important issues to help our patients. So we always advocating for access. So, example, in my own headache clinic in the center, I do have wonderful devices to show neuromodulation. They cleared by FDA. We have 5 FDA cleared devices for treatment of migraine. Some of them can be applicable for people with cluster and person with hemicrania, those extremely tough headache and disabling. And we do have devices which I would recommend, but access could be a barrier. And so we always advocating together for access to our patients. And this time during Neurology on the Hill, we again will be talking about addressing those barriers, including things like reimbursements, including things like how do we make care available to our veterans, these neurology centers of excellence. And I really love research. So in front of my eyes, headache field bloomed. So we went from almost very few medications to offer, or sending someone or discussing with someone, to surgery where neuromodulation device had to be implanted with neurosurgery, and then person would have leads here and batteries there, and it was whole process, few hours of trying to titrate to right stimulation in the clinic up and down of those devices. Now I'm telling to my patients, we can try. If you didn't like it for any reason or was not effective, we will go to next one. We put it in the box and send it back. So this is so much better.
That's amazing. And where do you think the biggest unmet need for research is?
Definitely identify biomarkers. It would be amazing when I see patient to say, oh, because you have these biomarkers, I think this medication would be the best for you. So precision medicine, individualized plan, as opposed to, well, we have to start with this medication, we give it good trial, and then we move to next one. And so biomarkers research and make it individual, make it straight cut what would work for this particular person is in the future. I think different specialties already doing progress in this direction. I see that medications for mood, our colleagues in psychiatry, they can check genetics and already predict to some extent. It's still not perfect at all. To some extent, okay, this medication maybe makes more sense for this person to start with. So I'm super excited about new treatments and identifying which treatment will work for this particular person living with migraine or other headache disorder.
So our organization actually has a podcast called Let's Get Personal. It's about precision medication and medicine, mostly in the autoimmune space, because there's been a lot of research and development there. So we have an audio guide, Understanding Precision Personalized Medicine for Rheumatoid Arthritis, and like how the present and future care of that. So I love that you're talking about this topic for migraine, because internally I talk to my colleagues. I'm like, why can't we have this for migraine? And I feel like we're moving in that direction. The more that I go to medical conferences, the more I'm hearing people like yourself say, we need to find a biomarker. And what that means for a patient is that we can then help you find a treatment that might work better. So you don't have to go through all of these, in an ideal world, step therapy edits and different fail first protocols. And hopefully insurance will get on board and not make it rough once we do find out what might work better for us. Really interesting stuff.
That's amazing. Thank you for this work you're doing. That's so great. I do believe that addressing things like rheumatoid arthritis and any other possible cause for inflammation or cause for secondary headache, very important. So example would be nowadays we have 1 in 5 people who have long COVID, they would have headache as one of the symptoms. And this headache would be so resistant. And we need to learn more how to treat it. And so one of the issues on Headache on the Hill during February 14th event this year was asking to help us to do more research for long COVID and specifically in headache medicine area.
Just a clarity for our audience. You talked about the autonomic system and disorders related to migraine. Can you explain what that is and what the connection is?
So because migraine is network disorder of brain symptoms, and we all know that one of the symptoms, for example, of cluster person, even on the drawing, if we just type cluster headache picture, it will usually show someone maybe a little bit of redness like flushing. It will show this like fire around eye. It will show that eye may be a little bit more close on one side. We call it ptosis. So eyelid can little bit droop. Some people, they can have these multiple headache disorders, migraine and cluster, even hoarse voice during attacks. And it's because this autonomic neurosystem, it's little bit shift in water in our body, and vocal cord can get a little bit more full of water. And some people, they're like, oh, now I know why I have hoarse voice during migraine attack. And so we use it for our treatments. So example would be sphenopalatine ganglion blocks. And we have those ganglions on the both sides of basically our nose, which in the past we have to go with needle either from the area of the mouth or from outside. And it was pretty extensive procedure with radiology or with interventional colleagues. And now we have devices, and those devices help us just make it application. It's almost like nasal spray, but it has this excellent efficacy for some people. And I love to offer this as a result of research, result of they calculated angle, how to get to the thin part basically in the nose for medication to diffuse without needle poke. So, and it can be very effective for some people. And I love when we can offer something without pain of needle stick, but effective potentially. So we keep bringing it up for different conferences. It's really nice thing for during some periods in women's journey in migraine. We definitely use a lot of safer for baby medication during this period of time. And ropivacaine in nasal spray or some nerve block with that medication can be pretty much safer than many other things which we can use during preparation to pregnancy, breastfeeding. So I do have special interest, and I'm thrilled when I see during telemedicine all these happy babies on the screen, or some people come with them. It's like wonderful experience. We do have PowerPoint, which anyone can invite speaker from American Headache Society. It's like invite for grand rounds for lecture or just review online. It's women's journey covering different treatments in different periods of time for women, starting with girl, going to older adult, and how to address it.
Well, I learned so much in this 15, 20 minutes that we spoke. Really appreciate your knowledge and also your passion. As I was listening to you talk, I'm like, your patients are so lucky that they have someone that cares and that is staying on top of the research and that is thinking outside the box to make us feel better. So really appreciate all that you do and your advocacy and the work that you do to advance the mission of headache specialists.
Thank you. Thank you so much.
Well, thank you so much, and go get them. Thank you so much for listening to this episode of Talking Head Pain, the podcast that confronts head pain head on. If you like this episode, please give it an honest 5-star rating and subscribe so you never miss another one. I'm Joe Coe, and I will see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.